Hi, everyone, and welcome to our NGPX webinar sponsored by ELO, the new normal patient engagement and self-service. Thank you for joining us. Before we begin, I'd like to bring your attention to the console in front of you. All the windows you see can be repositioned, maximized, or minimized to fit the device you're currently using to connect with us today. If you accidentally minimize a window, don't worry. Simply pop into the toolbar at the bottom of your screen to bring it back up. So now I'll introduce today's speaker. It's my pleasure to introduce Jeff Fountaine, Director of Healthcare Solutions at ELO. We're going to try to save time today and have a little Q&A at the end of today's discussion, so please feel free to submit questions for our speaker at any time during the presentation using the Q&A portal at the bottom of your screen. Now I'll pass things along to Jeff. Thank you.
Great. Thank you, Morgan. Really appreciate that introduction. So let me start by saying good morning to some of you and good afternoon to others. I want to thank you for taking the time today, particularly given the hectic schedule that you likely have within today's environment. But second, I would be remiss if I didn't express my appreciation for each one of you, for your teams, for your hospital staff, and really all the caregivers that are dealing with this pandemic. These are truly extraordinary times. And I just want you to know that I'm thankful for you. I'm thankful for the access that you provide to really the best healthcare system in the world. So I just wanted to express that appreciation. So as Morgan said, today's session, we're going to focus on patient engagement and self-service. And it's not just a new normal because of COVID-19. It's really a new normal because the idea of enhancing patient engagement, the moment that patient comes through your facility's door with a self-service platform, is really becoming the industry standard. It's really becoming necessary for so many reasons. So today I plan on mixing some conceptual thoughts with really some concrete recommendations for how you may look to augment, how you might look to improve, how you may implement a self-service platform that really streamlines that patient registration process. So I hope, with today's session that you'll leave with three really connected learnings. I had to stop in developing this content and really ask, why do we always develop things in threes? I got to think I was taught this somewhere in high school or in college, but like anything these days, I went to Google, and there was a really interesting sort of a funny piece that came out of Forbes magazine, written by Carmine Gallo. He talked about the rule of three in terms of communicating, and he talked about how it was good enough for folks like Thomas Jefferson or Steve Jobs, how it was good enough for the TSA. So certainly I thought that was funny. I'll let you decide which one of those three don't necessarily belong with the other two. But regardless, I do. I hope that you're able to walk away with some key insights for implementing a modern, engaging self-service platform. I'm looking forward to really sharing with you some perspectives from other market segments like retail, hospitality. And then finally, hopefully give some tools to utilize as you design your engagement processes around self-service. Now, before I dig into the specifics, I really felt like it would be prudent to talk about COVID-19 and the impact that it's having on our economy, right? The impact it's having on our healthcare system and really the business of healthcare. I've had the fortune of talking with several different health systems in the past 6 weeks about many ongoing projects and certainly where their business stands. And so we all know that a great deal of focus is being placed on caring for COVID patients, and that's had impacts on things like even elective procedures. And so we know these are very difficult times within our hospitals, within our health systems. And so it's interesting because those that I've spoken with have talked about this roadmap that you see in some form or fashion, right? They've certainly talked about flattening the curve. We've heard that phrase so often. They've talked a bit about the stimulus dollars, right? The need for continued investment in our hospitals and health systems so that they remain financially viable. They've mentioned that need to prepare, right, for a second wave, whether that comes this fall or maybe the early parts of winter. And certainly, look, I mean, we all collectively hope that a vaccine comes sooner rather than later. But the common theme from really most of them was that we must continue with the business of healthcare. And that's going to require us to look for new ways to automate, new ways to engage, right? New ways to attract patients to our healthcare system. And so, I think these new ways can be viewed as that digital transformation. And again, the common theme in many of these discussions is that transformation really must accelerate. So it's about investing really in these digital processes that create efficiencies, right? They might drive loyalty. And that can certainly be incredibly helpful to hospitals during these difficult financial times. And so that leads me to share a bit more broadly about something that is being termed the experience economy. Right now, this is a global trend. It's a global perspective that's impacting all types of businesses as they think about transforming themselves to really focus on the individual, to focus on the journey, to focus on the life cycle. And so it's less about really designing a great product or designing a great service. It's about delivering an experience, right? And so I think of Apple, and I think of when Apple launched the original iPhone, and really the transformation that they have been on from 2007 to today. So I think about the difference in their identity past and present. Steve Jobs, he took that stage in 2007, and he talked about how he was holding not just a phone, but a music player, right? He was holding not just a phone and a music player, but really a web-enabled device that would give you access to almost infinite content. Now think about Apple today. I mean, it's vastly different. It's really about how that phone enables your life, right? The videos that you take of your child learning how to ride a bike, maybe some photos of your teenager scoring a soccer goal. My favorite, that sort of unforgettable sunset on a vacation. And certainly incredibly relevant today, even personally with me, the ability to video chat with grandma. It's about an experience today with Apple. It's not about the product. I think there's a lot to be learned there. And the same can be said for a company like Tom's. So hopefully many of you are familiar that they make shoes. They make great shoes, right? They're comfortable. But for them, it's just as important to sell you a pair of shoes as it is to deliver a pair of shoes to someone in need, right? So they say they're built for a purpose. Now look, certainly profit ensures people get paid. Profit helps Tom's continue to innovate. It's important, but for Tom's, it's really more important to deliver on that purpose than it is on every single profit cent. And so, finally, I thought that the travel industry has plenty to teach us about what it means to personalize our experience. I, maybe fortunately and unfortunately, travel quite a bit in my role. I like to say fortunate because my wife is often glad to see me leave for a quick 2-day trip. But I think it's unfortunate because I know my dogs will miss me every time I walk out the door. But anyways, I digress. It's been interesting to me to watch these past 3 to 4 years and really see how the travel industry has worked quite hard at personalizing my experience. There's a great example, right? So when I walk through the door of that Marriott Courtyard, I get to bypass that front desk because they've already delivered my key card to me. They've delivered it straight to my phone. It's certainly a really good example of this sort of concept of mobile to in-person from an experience standpoint. That personalization effect is even, I think, extending into some really small, just simple services, like providing a route map for a morning run. These hotel brands have really come to understand that my loyalty as a consumer is really about the experience, and it's not just about amassing points. So I think my encouragement to you here is just to give you some thoughts, give thought to your organization about how you might deploy aspects of this experience economy, that's ultimately driven by your purpose. And so let me just sum it up really by saying, I think this is a really unique opportunity in healthcare. And it's why I just personally love being a part of this industry by really serving. Because I think your purpose is so deep, it's so emotional, it's so impactful. Ultimately, you work so hard each and every day to generate positive outcomes for your patients. That's what I really call being purpose-driven. So with that sort of added context, now let me dig into some key trends that are driving patient engagement technologies. First with mobile, it's becoming increasingly important for so many different reasons, right? Could be access to medical records, the ability to schedule or reschedule, the idea of being able to process a payment from my mobile phone, interacting, right, with a medical professional if I've got questions about my medications or maybe someone that I'm caring for about their medications. So I'm guessing most of you on this call have implemented some form of a mobile strategy to engage with your patients. And I think that's only going to accelerate as more people really expect to have these kinds of interactions outside the four walls of the hospital. And I think we've certainly seen this during COVID-19. The tremendous increases in telehealth access, telehealth engagement. That's a perfect example of this sort of mobile experience outside of those traditional walls of your healthcare system. But really alongside mobile comes automation. So think of this as maybe the idea of taking burdensome tasks from a process and automating them with technology. Could be appointment reminders, right? Maybe requests to update demographic information or insurance information. Potentially help with calculating a copay for a certain procedure or the deductibles. These are all items that can be done with automation, removing that human interaction. And ultimately, that results in you being able to redeploy that service professional to more high-value tasks. The next, I think, most significant and really interesting wave that I read about is artificial intelligence and machine learning. So these tools that really make automation that much more efficient, that much more supportive of the care journey. So one really good example that I read about with respect to how artificial intelligence was making cancer diagnosis, cancer treatment that much more efficient, really ultimately allowing caregivers to spend more time with the patient, less time conducting extensive research, easing that cancer care journey. And so this trend and really the technology tools of AI and machine learning, they have tremendous potential the next 5 to 10 years to really help you revolutionize these engagement pathways for patients and even patient family members. So finally, we're really just now starting to hear and see more about the concept of experiential design and how it can interrelate to patient engagement. So I really love what I heard from one health system that was looking to redesign their clinics. So they were looking out a few years. They were thinking, how can they align the design of their new clinics to really their purpose, to their mission? And so this health system talked about this, the chief medical officer talked about a guest-centric experience with a collaborative, convenient, and wellness-oriented approach. Now, the CMO, she freely admitted this was not traditional. It was not something that was embedded in their culture. But it was really born out of the idea, out of the investment in experiential design thinking. You know, she commented that it came from challenging themselves to meet some really visionary goals. And so let me just say this, right? You know, trends are just that. They're trends. Each one of you is going to be at a different place in your hospital, a different place in your health system. You have very different goals. And you're certainly going to identify different paths forward. So with that being said, it is time for a poll question. So we thought this would be a great opportunity for you to interact with us and also interact with each other. So I'd encourage you, hopefully you can see the poll question right there on your screen. Take a few seconds, help us out, and respond to the answers, and we're going to tally some results here in just a moment. Let's see how we've done. Interesting. Yeah, fantastic. Really appreciate you responding. I think this is really good information. I think it's helpful also to all your peers on this call. So let me take the next couple of minutes, right? I really want to share with you 3 strategies that we developed for this session that have been cultivated, right? They've been cultivated through interaction with folks like yourself, with different healthcare providers, different technology companies that are serving this engagement space, and also with industry experts. So I want to start with the graphic. I really want to point out that it pinpoints the patient in the middle, right? And then surrounding the patient are a set of strategies. They're really designed to improve that engagement, that experience throughout the patient life cycle. So we'll start just at a high level before we dig into each one of these in detail. But let me say it starts with the concept of knowing the patient, right? It's interesting because we're seeing the implementation of customer relationship management or CRM software applications. You know, they're really designed to help healthcare providers become better informed about the patient. You know, the deployment of this technology within this strategy is creating visibility unlike you have likely seen previously, visibility into the patient needs. And there's aspects like how to best communicate with them, what kinds of historical information is critical, you know, integration to even financial components, and really a whole lot more. But then it's becoming increasingly clear that patients want to be empowered. I think they just want more control of their journey, of their experience. This is true, again, both outside the 4 walls, as I mentioned previously, but also inside the 4 walls. The central fact that patients want to be engaged really when, where, and how they require has led many hospitals to deploy self-service platforms to augment the experience from mobile to in-person. And then finally, it wraps with the experiential concept, right? of delighting the patient. Now look, I know this is never easy, right? Especially given the diverse populations of people that you see on any given day. But the goal really should be to strive for convenience across that engagement spectrum. And then I like to say, sprinkle in just a little dose of hospitality at each and every touch point. And so finally, what I particularly like about this model is the feedback loop. As we learn more about a patient, we can incorporate those learnings back into the know me phase and really iterate on this process all over again. So let's take a closer look into each strategy. I like how one health system articulated their journey to know a patient in a recent Harvard Business Review article on patient experience. This hospital system, they were trying to be what they termed holistic and person-centered, not disease-centered, in terms of their approach toward patient engagement and patient experience. And those are their words. Very interesting. And so I'll paraphrase their approach a little bit, but they essentially said that they were utilizing the single view of the patient with the idea of delivering that one-to-one experience. They felt the result was better trust, more trust from the patient, more loyalty to that healthcare provider. They talked about the culmination of the results, and those results were higher experience scores. And they certainly referenced that, more importantly, the results pointed to better clinical outcomes. Now, if you think about this from a technology perspective, it's about utilizing an omni-channel approach throughout that care journey that enables this kind of know me experience. There was a recent article from McKinsey, right, that talked about the merging of offline and online experiences. And statistics were showing that, focusing on this level of personalization between online and offline really saw a substantial increase in retention and loyalty. Again, it was about knowing the patient and being person-centered. Right, so what does this really mean? What should you functionally do to implement this strategy? Well, it starts with access and transparency to the process. It's clear that this creates trust between the caregiver, between the hospital, and the patient. So there's a number of studies, right, that have shown that building trust leads to better clinical outcomes and really lower costs for the provider. But it's about efficiency. And I think this is particularly true of younger generations, right? We have multiple generations now that have grown up in this self-service economy, whether that be through the internet, through their mobile phones, in an in-person experience. These generations now are expecting tools to be available to them when selecting their healthcare provider, when utilizing their healthcare provider. Now, as I said earlier, it is incredibly difficult, right, for you because of the differences in patient populations that you serve. But just be aware that your next customer, your next patient, is likely to be of a generation that wants access and efficiency in how they engage. And that leads me to the final point here, really about modernizing the experience, modernizing the engagement process. So I have a colleague here at ELO who is expecting twins later this year. And he loves to send me pictures of his local healthcare system and their strategy toward self-service engagement. These are pictures that, they show the kiosk, it's deployed in the corner, it's got the laser printed sheet taped to the screen that says not in use. I gotta admit, these kiosks look like they were designed in the early 2000s. And so, I bring this up because I think modernization will go a long ways toward increased engagement, increased utilization, which is such a key point in terms of deploying your self-service platform. And so think about it. Look what we're starting to see in retail, in restaurants, theaters, stadiums, with respect to modern self-service platforms. That folks ultimately are seeking these out to engage on them rather than interact with a human. And so finally, let's talk a bit about Delight Me. And so I thought this would be just a fun way to share thoughts around this concept of how we can delight patients. So I spent time as a pharmacy tech in high school and parts of college, where I learned that one TBID AC really means take one tablet by mouth twice a day before meals. And I'm guessing some of you may be smiling because you know exactly what I'm talking about. But instead of really go through everything here, let me just highlight a couple of items. So first, it's critically important to talk with your teams about how technology is not replacing people. Now, this is something that I commonly hear in really most discussions with healthcare providers. Right? Technology really means that we're going to make the life of the patient that much easier. We're going to make the work effort that much more meaningful to the hospital employee. I had a client tell me recently that certainly this took time, right? But their staff came to really understand how doing different tasks, really more high-value tasks, became more purposeful, became more meaningful. And that's when they knew they had the buy-in. The staff came to realize that, moving up that value chain brought greater satisfaction to the patient. And so look, we all know change is difficult. Folks write about this all the time. We comment about it all the time. I think it's pretty simple. It's just going to take time, but more importantly, it really takes consistency of effort. And so next, let me highlight one more item. I do strongly recommend that you emphasize all these, what I would call available routes to engage. This is something that can be done in conjunction with the hospital or the health system marketing team. I had another, client that shared with me a story about how they built a message entirely around the ability to engage via their self-service platform. This story, it highlighted the mobile to kiosk experience that was available to patients. I think it's just a really smart way to leverage multiple parts of your organization to really assist you in your patient engagement mission. And let me just give you some results from this particular client. They were ultimately able to show significant increases in revenue as well as cash capture. And let me explain what I mean by this. So as they went out into the community and told this story about how they've created a self-service platform, how patients can engage with it, what patients found when they came into the facilities, particularly the emergency departments, they came up and engaged on that self-service platform, they were actually consulted with. they were actually given an opportunity to go and visit a nearby, located just across the street, clinic that could perform certain functions that maybe weren't necessarily required of the patient in the ED. And so the patient got a much better experience by being directed to a different location for a relatively routine service at a lower price point. And the feedback was universal across these different patients. They appreciated that experience. They appreciated the engagement platform. They appreciated the knowledge that there was a different mechanism, a different vehicle whereby they could receive care at a lower cost point and in a more efficient way. And so that freed up the emergency department space, and it also made that clinic that much more productive. A number of different benefits just by simply articulating the story through that self-service platform. It was really, really an interesting situation and an interesting outcome. So let me just do a quick recap of this patient engagement strategy. First off, it's about to know a patient, right? And to know a patient is to be person-centric. Then it's about empowering that patient, because empowerment is going to create trust and it's going to create loyalty. And then lastly, delighting a patient. It's really about marrying technology with these higher value work efforts from your staff. And so I'd like to pause really for just a moment and shift gears. Learn from other market segments. So ELO, my company, does a tremendous amount of work in retail, hospitality, transportation. And so I asked my peers who lead those market segments to provide some input for today's sessions, input on the best practices that they see. And so Rick Smith, who leads our self-service efforts, he offered the following. He talked about how important it is that you focus on details from the onset. That the only way for a deployment to truly be successful is to achieve high customer adoption. He talked about to do this, you're really going to need to ensure that your software systems are of the highest quality, they're tested thoroughly, the kiosk needs to be installed in a convenient location, really in the path of the patient to traditional registration processes. And then, he also encouraged the use of kiosk ambassadors, right? So located nearby that are really going to encourage, train, help patient family members interact through these self-service platforms that you're deploying. But Rick also offered up another thought with respect to the airline industry. So I really wanted to share this. So, his comment was that the biggest thing the airline industry had to realize was that the number one issue was an imbalance of customer to employees. You think about it, when a traveler needs to rely on human interaction during every sort of point of their trip, it can cause a slowdown, right? Frustration, decreased customer satisfaction, inefficient processes, right? But by promoting self-service wherever possible, whether it's check-in, it's seat assignments, it's flight changes, it's baggage, right? This allows the customer to get faster, really, and better service. So I thought that was very insightful. And then also from Sonal Apte, who leads our retail segment, she commented on this. She said that customer control during the self-service experience has shown greater satisfaction. Right? So if I can control my experience, I'm likely to walk away more satisfied. There's going to be less wait times, right? And I thought this was really interesting. The comment of higher overall revenue due to larger ticket sizes. So this idea that we buy more through a self-service platform in a retail segment. And so there was a couple of other comments I wanted to share. She talked about how the experience in retail, it's becoming more minimalistic. Gone are the days of the big branded metal enclosure kiosks, right? Much more minimalistic. And this final point, I hope you'll take away this final point. She talked about how the retail industry has learned that a screen mounted in portrait mode, right, so up and down, screams smartphone, right? It screams, come interact with me. Whereas a screen that is mounted more landscape, like television, has people thinking really only that that's there to view information. It's not there to interact. So I think that's a really interesting data perspective from an industry that has really dug deep on self-service. So with that, we do have one more poll question. So I hope you'll take a couple of seconds and consider the question. Pick a choice, and I'll give you about 10 seconds here, and then we'll show the results. Thank you for responding. Interesting to see those results. So now let me turn back to healthcare, and let me share some of the leading trends we see in self-service. So we're really beginning to see more healthcare providers, design patient registration processes to self-service first. This seems to take a lead from the airline industry, as shared by Rick Smith previously. More and more clients I speak with are asking that patients, when physically possible, utilize these self-service platforms as the starting point to their experience. And those starting points, they're now looking to integrate more biometric markers, right? Biometric tokens that are tied to the single record of truth. We're seeing certainly, right, more and more facial recognition applications, probably as a result of our smartphones. And implementing this technology certainly enhances efficiency, right? But it also leads to a deterministic identity that helps to reduce a number of these duplicate record challenges that we see in the market. So the most obvious deployment trend that I've seen of late is really the use of payment terminals, right, at self-service kiosks. I'm consistently hearing from healthcare providers that it's no longer acceptable to defer to mailed payments, to mailed bills. It's really now when we need to collect that copay, collect that deductible. And so, all of this, again, is being tied together from an omni-channel perspective, right? If you think about whether I want to pay on my mobile phone prior to entering the facility, perhaps you text a message to the patient to confirm an appointment and complete a copay. So from mobile to in-person and really beyond, we're seeing that omni-channel integration. And so finally, I do want to point out, right, so the question oftentimes I get is, how do we accomplish all of this while keeping costs down for deployment? The hardware historically, right, has been expensive. Kiosks of old, they tended to cost thousands of dollars per unit. But I want to tell you that is changing, and it's changing in a very positive direction. And so let me make one final point as it relates to self-service platforms. We've talked about modernization, right? We've talked about omni-channel. We've shared some detailed best practices on deployment. And look, these are all critical, highly relevant. But the missing link most often noticed is the UX or the UI, right? So by UX, UI, I'm talking about that user experience and the actual user interface from a software perspective. So, here's my encouragement. Many of you have already implemented a software solution. Some may be considering it for the first time. Some of you may be looking at an upcoming refresh of your self-service platform. So, wherever you are in the process, I recommend that you drive hard on your software component. You drive hard on your software partner. Push them to match the same experience that you're working so hard to deliver from a staff and clinician perspective. It's interesting if you stop and think about it. All of you on this call each and every day work to deliver the best patient outcome possible, right? It's 24/7, 365. It's a high bar. But I would argue it's just the right kind of bar your software providers should want to exceed. They should want to join you in delivering great software with great experiences. And so that's really why I suggest you push on them. Make them match your efforts, because it is very much a key part of the experience that patients are going to walk away and remember. And so we're nearing the end of today's presentation, so just a few more thoughts. I wanted to incorporate this slide or this conversation into the discussion, really similar to the previous slide, because I wanted each of you to consider for a moment the kind of experience, the kind of design thinking that has gone into your cancer treatment approaches, into your labor and delivery wards. Cancer treatments, they've come so far, right? They continue to evolve. They continue to innovate. The approach to managing the care process surrounding cancer has changed in really substantial ways. Healthcare providers, I'm guessing many of you are working diligently to change that experience when it comes to cancer care. You're investing in that process, in that journey. And so I think the question I would pose is, what can you learn from those investments? What can you learn from those changes to process that have really helped that cancer care journey? How can you deploy that more holistically across your organization in all manners of care? Really, the same goes for labor and delivery, right? The rebirth of the labor and delivery space for mothers, for their newborns, for the extended family. I would argue it's become an experience. And it's become an experience designed to delight really everyone in the process. So just think about that. And think about the application of that more broadly in your organization. So final piece to share today. So I want to go back to that same Harvard Business Review article on improving patient experience. I believe it's definitely worth the read. And they spend a good deal of time talking about loyalty. Now, certainly loyalty begins with the idea of delivering outstanding care, right? Delivering a positive outcome. But it also comes from trust, which we previously covered. And we know for sure that we can draw a line connecting loyalty to higher revenues. This is true in retail, it's true in hospitality, transportation, and it's certainly true in healthcare. And so I truly believe this is an area of unexplored territory. I got to tell you, I personally believe, or I personally would love to explore this in greater depth from a solution perspective, really with any of you. And so let me maybe sum up loyalty with this example. I obtained my health benefits from Aetna. And Aetna's created this engagement platform. It's called Attain. It's basically an app, right, for my smartphone. It tracks my activity. It gives me little helpful tips each day on how I can be healthier. It has grabbed my attention. And I kind of ask myself, why? Is it because I just want to be this healthy person? I mean, I do, but if I'm being really honest with you, that isn't the reason it has my attention. It's simply because Aetna offers Amazon gift card credits. Now, they're in very small dollar amounts because of my activity. But to be frank, I'm somewhat obsessed with it. So much so that, my wife is getting tired of these evening walks just so I can get my activity credit. Think about it. The cost to Aetna is a measly $5 every couple of weeks. But I'm certainly living a healthier lifestyle. And because of that, right, that means more profit for them. Maybe not the best example of purpose over profit, but it is delivering results. Think about it. I am thoroughly engaged in that loyalty application. So just something to consider. All right, so let me summarize, right? So what have we learned together today? Well, first and foremost, we talked about an engagement strategy, right, that's centered on the patient. It included 3 elements. So knowing the patient, knowing that patient and being person-centric. Talks about empowering the patient by modernizing the experience. Delighting the patient by really moving your team members to these higher value tasks and thus more meaningful interactions. We learned about various best practices from other industries, right? How to design a self-service first platform like the airline industry. How to think about deploying hardware so that it screams, interact with me. How to leverage best practices even within your own hospital or health system, like labor and delivery. Last, we talked about loyalty as an opportunity, a way to increase engagement, trust, retention of your patients. It certainly is an area that requires further exploration, but the potential is significant for our health systems and really all the services that surround them. So I hope that you feel like you walked away from today's discussion with a better understanding of these aspects. And so let me close by briefly talking about ELO and how we can help you. So I just want you to know that ELO is designing and delivering modern self-service hardware platforms for healthcare providers today. We're deployed in many different hospitals, many different health systems across the country. And we're really doing so in a very cost-effective, easy to deploy manner. And so we would welcome the opportunity to speak with you about your projects, about your requirements, and about how ELO thinks differently when it comes to self-service. So what you see on your screen it's really just a small sampling of what we can do, from wall-mounted to countertop to floor stands. Our interactive touch solutions help drive patient engagement, help improve that patient experience. And so please reach out to me with any questions, any feedback, or if you simply just want to follow up on any of the points shared during today's presentation. I would certainly welcome the opportunity to speak with you. So with that, let me just say thank you so much for your time, for your attention, for your poll responses. I'm going to remain connected for the next few minutes, to answer any questions that you may have. So please feel free to use that chat box to relay any questions that you'd like addressed. With that, let me hand it back to you, Morgan.
Thanks, Jeff. That was definitely a great deal of insight that you had to offer today, and I definitely want to thank you for offering your time for us today. We're just going to jump into a couple of questions in our Q&A, and one of the first ones that we have is, as far as emergency department kiosks, have you gotten any feedback from the patients, and how do you manage volume?
Yeah, great question. So let me cover volume first. Certainly in talking to a number of different hospital systems, it's critically important to balance volume, balance time of day. There's a lot of questions in that with how you deploy a self-service platform. What is the right quantity of units? What's the right location? What's that architecture look like? What's that space feel like? And then, which sorts of patients are we looking to direct towards these kiosks? I don't think that there's one answer really that covers all environments, and I know you'll appreciate that for the individual that asked that question. I think what I've learned in conversation with folks is to test and iterate. I think that's probably the one thing I would impress upon you with response to that question is, think about the environment, make a best guess based on what the data is telling you, test that, and then think about iterating on that. I'll just real quickly share with you that example I talked about that emergency department, the self-service platform that they put in place, how they qualified the patients and what the patients were there presenting with, and then how they redirected certain patient types to a nearby clinic for improved service and really ultimately a better process than using the emergency department. It took that hospital system many different iterations to get it right. So there's no one-size-fits-all question. I would encourage you just to think about test and iterate.
Awesome. Thank you, Jeff. Our next question is from Kelly, and Kelly asks, I'm curious about how you're thinking about your touchscreens in regards to COVID. How will you protect patients?
Yeah, thank you, Kelly. Thank you for that question, and really an important question, right? So, for us at ELO, we are definitely looking at our touchscreens across all vertical segments, right? And those interaction points, in making those interaction points as healthy as possible. I will say this, right? So the nice thing about our solutions is that they can be cleaned. So you can use your Super Sandy wipes, your Cabot wipes, your common infection control cleaners to wipe these devices down. And so, one hospital example, and I sort of smile because hopefully you'll smile as well. They have on one side of the kiosk or the self-service stand that you saw in one of the pictures, they have a tub of Sandy wipes, and then on the other side they have a bottle of hand sanitizer. So they're clearly articulating, right, to the patient family member. Take the opportunity to clean it, just as you might do in a grocery store with a grocery cart, and then also take the opportunity to sanitize afterwards. But we're also looking at innovative ways to protect the screen from these kinds of infectious germs. So it's not just about cleaning, it's about potentially resistance too.
Great. So we have a little bit more time to get to a couple of more questions. Our next question is from Jerica, and she asks, have you seen hospitals or practices use text reminders for following up on financial assistance applications, their status, missing elements, and still need documentation, etc.?
I have seen this sort of text interaction. Now you provide some great detailed specifics. I would say this. What I've seen from a lot of folks is this sort of multi-contact deployment, right? So texting for appointment reminders, clicking into the text, being pulled up a mobile web page where you can confirm that appointment. You could potentially process a payment. I've seen examples of surveys and sort of or post-discharge, post-discharge, where folks are implementing technology to follow up with that patient. So certainly I think it's probably incumbent upon software providers to help you address your question. But certainly I'm seeing multiple ways to interact with patients. And I point back to that comment, right, about the generations. You think about Generation X and Y and Z and whatever's next, right? You think about all these folks grew up in this sort of self-service economy. And so they're expecting these kinds of interactions. They want these kinds of interactions. So I certainly think pre-appointment, post-appointment, it's certainly applicable to provide multiple touch points for those patients.
Great, thanks, Jeff. Our next question is from Aaron, and Aaron asks, is this product compatible with EMR systems, i.e. Epic?
Yeah, thank you, Aaron. Really good question. So it is. So our platforms, so the ones that you saw in the images currently on your screen, they support both Windows operating system as well as Android operating system. So I know that Epic Welcome, they publish specifications around Windows, around the kinds of hardware technical specifications, and our devices absolutely meet those. In fact, we're deployed in a number of Epic Welcome hospitals currently.
Great. And our last question is coming from Mark. And Mark is asking, can you provide examples on specific solutions for use during in-hospital or inpatient or during hospital stay?
So thank you, Mark, for that question. I guess I'm wondering if you're referring to self-service during a hospital, inpatient stay. Nothing specifically comes to mind, although I will share with you this. ELO, we make a number of different touchscreen displays, touchscreen monitors, touchscreen computers, and we're seeing that sort of touch deployment really all across the hospital, whether it's a nursing station, whether it's a patient room, whether it's the ED like we talked about before. And so we're seeing some interesting things where they're suggesting an interaction for patient education, right? So they can use one of our interactive displays and they can actually interact around a patient education session, a telehealth session, a number of different things. So I think maybe in summary, again, and I apologize, I was not quite sure about the question, but we are seeing a number of deployments for various different touch points where you want interactivity, where you want engagement with the patient during their care journey.
Thanks so much, Jeff. So as we get a little bit closer to the ending, I think I'm going to bring us all to a close, and I want to thank you all for joining us today, and thank you all for taking the time out to join this digital experience today. If you submitted a question that we didn't get to, we'll follow up with you by email shortly, and you can look forward to receiving this presentation directly to your email inbox within 24 hours, so definitely keep a lookout for that. And finally, I want to give a huge thank you and a round of applause to you, Jeff. Thank you so much for delivering all of that awesome insight to us today. And also, please remember to leave feedback and suggestions for us in the survey at the close of the webinar. We'll use that feedback guide to guide us in providing us feedback in webinar topics and future webinar topics so that we can give you exactly what you want in the future. So with that, I'll bring this program to an end. On behalf of ELO, NGPX, and WBR Insights team, we would like to thank you for your time. Have a great day.